I think it's fair to say, and I'm almost 50 years working in healthcare, both in America and overseas. This is by far the most challenging period I have faced. I could not choose just one crisis. Forced to do so, though, I would say workforce is always been a harder issue in rural Wisconsin than the rest of the state. And now we actually have two workforce crises. We have a short-term one that's directly derivative, I think, from current inflationary times, and that manifests itself with a lot of CNAs leaving for easier work at fast food chains, and then creates a whole bunch of systemic problems. Also, due to what was a horrific period for so many healthcare providers, we just lost a fair number to early retirement. They were just burned out. They were tired of the double shifts, tired of being yelled at, tired of a whole bunch of stuff. But that's, I'm going to argue, is not the biggest workforce crisis we face. The biggest one we face is, unfortunately, people like Jim and I are increasingly an anomaly, that we don't believe in retirement, but baby boomers are retiring in increasing numbers. And unfortunately, as we age, we not only retire, but we also use healthcare at 3, 4, 5, 6 times greater rate. You combine those two pieces of data together, and you get the results that George will talk about. I think the DWD results are already mentioned. So we're talking, I chose a different year, 2030, 17% gap in RNs. Well, that's like tomorrow, 2030. That's not some abstract future date. And I know from George's data that it isn't just nurses that will have similar high double-digit gaps, but it will also be most, not all, but most of the other professions. That level of shortfall will make the challenge we had last winter when our system was in free fall look like child's play. So the crisis is not yet upon us for the long-term workforce issue, but that train is coming at us real quick.